Hi, this is Dr. Adrian Lopresti. Join us on FX Medicine next week, where we'll be talking to Dr. Sanjeev Sharma about his integrative and person-centered treatment for ADHD. Subscribe to us on your favourite podcast app, follow us on social media to make sure you never miss an episode. Hi, and welcome to FX Medicine, where we bring you the latest in evidence-based, integrative, functional, and complementary medicine. FX Medicine acknowledges the traditional custodians of country throughout Australia where we live and work, and their connections to land, sea, and community. We pay our respect to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander people today. Dr. Diana Karamacoska is a cognitive neuroscientist researching the use of lifestyle and complementary therapies to improve and maintain brain health. In 2019, she was awarded her PhD in psychology for her work in exploring the neuronal mechanisms of attention, cognition, and behaviour. Diana is now undertaking a postdoctoral research fellowship at Nickham Health Research Institute and runs Australia's largest clinical trial for vascular dementia and Alzheimer's disease mixed with cerebrovascular disease. Diana has a strong interest in understanding how lifestyle interventions such as physical activity and diet, and herbal medicine and alternative therapies can affect neurocognitive functioning. It is her expertise in these areas and their impact on brain health that we will be discussing today. Okay, welcome to FX Medicine, Diana. Thanks for being with us today.
Thank you so much for having me joining you on this podcast. I'm really excited to be here.
And that's an absolute pleasure to have you on board and certainly to talk about some of your experiences and research that you're doing. So the first thing I wanted to ask you about is, I know that you're conducting a large clinical trial on dementia. Can you tell us a little bit about that trial and what you're specifically investigating?
Absolutely. So we are looking at vascular type dementia in this clinical trial. And so for those of you who might not know what that is, it is the second most common type of dementia that gets diagnosed. And it's generally brought on by stroke or a series of mini strokes. Now, this condition is actually something that my grandmother lives with. So I was kind of personally motivated to get involved in this project. Just because of what her experiences were like in trying to access medications or interventions to support her. So we do have this vascular dementia clinical trial that's been running for almost 10 years. And we are investigating a novel herbal formulation containing 3 ingredients that have been traditionally or historically shown to have really memory boosting qualities to them. So those 3 ingredients are ginseng, ginkgo biloba, and saffron.
Wow. So how long is the intervention for?
Yeah, the intervention runs for 12 months because we were really interested in looking at not only the impact this would have on someone's cognitive functioning, but also, the safety of these sorts of herbal formulations. Yeah. So the clinical trial is in the phase 3 stage, which is nearing completion. And depending on the results of this trial, we would decide if it becomes commercially available for the public.
Great. So sample size, how many people are you recruiting?
So we had to revise our numbers during the pandemic. It brought on a lot of changes to the way that we conducted this clinical trial, and we actually had to suspend it because of the barriers that we were facing in trying to access not only the product, but the people on the ground who were requesting to be involved in the project. So our latest numbers are at 250.
Wow.
And
it's a good sample size.
It is. It's not as big as some other major clinical trials that are funded by pharmaceutical companies, but it's certainly the number that we need in order to establish its impact and effectiveness.
Wow. And so when do you think you'll be able to complete the study and have the findings?
We're really hoping to complete this project next year and promote the findings, or at least publish the findings shortly thereafter. We've had participants enrolled in this study, for nearly 10 years. So it'd be really good to give them some information about how things went.
Yeah, absolutely. So vascular dementia, is that, obviously when people think about dementia, they more commonly it's Alzheimer's disease is what people think of when it comes to dementia. So vascular dementia, what percentage of cases does that represent compared to Alzheimer's disease?
So vascular dementia being the second most common type that's diagnosed, it tends to occur in around 20% of the dementia cases we see. And so, as you mentioned, Alzheimer's disease is the more prominent one that you hear about, and that's because it is the most common. You get up to 75% of people being diagnosed with that one.
Well, I'm certainly looking forward to the results. There are 3 ingredients that I know have been researched with regards to cognition and mental health, and I've done a lot of research on saffron myself. I'll be eagerly awaiting. Well done. So, and I know that during the COVID pandemic, everything kind of changed and stopped, and so for you to finally complete it, that'd be a great sigh of relief.
Absolutely. Yeah. So if any of our listeners want to, follow our progress, they're more than welcome to check out our protocol paper that we published and just look for updates through our social media accounts.
So tell us a little bit about, from I suppose a biological or physiological perspective, what's the main drivers of brain aging and dementia?
This is such a good question. And, there are different reasons for the different dementias that we see. So as I was talking about before with vascular dementia, it is commonly caused by stroke, which are the bleeds that happen in the brain. And then for things like Alzheimer's disease, what's really driving this on is the accumulation of toxic proteins like amyloid beta and tau. Like our brain just does not have a way of clearing these out at the moment. And so as they build up over time, it starts to impact the health and functioning of the neurons. And so that's, when you start to see behavioural changes occurring in someone. So it could be things like memory loss, decision-making changes, and even, with mobility or vision and hearing.
So the symptoms of vascular dementia and Alzheimer's, are they similar? Do they present the same in terms of symptom-wise?
Well, no 2 dementia cases are going to be the same. The symptoms as they appear really do vary between person to person. And it's when you start to look at the biological indicators of these types of dementias is when you start to get clarity around the type that they can be diagnosed with. Mm-hmm. So it's quite tricky.
Yeah, absolutely. And with the build-up of amyloid tau and plaques and so forth, is that just something that builds up over time as we age, or is there things that are occurring that contribute to that increased build-up over time?
Yeah, this is a hotly debated topic in the literature. So as we're starting to learn more about the causes of these diseases, we're starting to look into the environmental factors that can be contributing to it. Personally, though, I'm not fully immersed in that literature, so I can't comment on it myself. So I do encourage listeners to maybe take a deep dive if they can, if that's something that they're really interested in.
I know there's a lot of literature now, obviously looking at factors, other things like inflammation and that there's increased inflammation going on that might also contribute, or whether the amyloid plaques and so forth are contributing to that, oxidative stress, and obviously there's also decreased glucose availability and mitochondria changes. So I suppose a lot of those factors are going on too. But certainly, can you test for the amyloid plaque buildup, or is there a common test that you could do to measure that?
I'll be honest, I'm not into the medical side of the diagnostic process. I have a feeling that you can get this assessment done through cerebrospinal fluid extraction. And I think these days, in terms of getting a diagnosis, the indicators that doctors are really looking for are changes in brain volume through brain scans, like MRI scans. Mm-hmm. So I guess that's kind of the big indicator that doctors would be on the lookout for.
Yeah, I'm sure people aren't jumping to go get the cerebral spinal fluid excreted. I don't think that's something that people want to do. And so can you tell us a little bit more, I mean, in terms of environmental factors, what else is, what other things are going on that might be contributing to dementia and Alzheimer's and so forth?
Yeah, certainly. So lifestyle plays a really big role in dementia risk. The latest Lancet report has identified 14 risk factors that can be controlled through, our interactions with the environment and the way that we live. So we have things like physical inactivity, which is always a big one, not only in dementia, but in a lot of other chronic health conditions.
Mm-hmm.
And, you have the usual culprits like excessive alcohol consumption and smoking. We have things like other health conditions like hypertension or high blood pressure. High cholesterol now has been added to that list. Diabetes and obesity. And I guess all of those is important to highlight. All of them are underpinned by lifestyle like physical inactivity, dietary choices, and, whether a person is able to effectively manage their health using other interventions like medications, for example. Yeah.
It's interesting. I read that paper. I read that Lancet commission, and obviously the 14 modifier risk factors, and you mentioned most of those there. And obviously there was things like obviously social isolation and air pollution, which was interesting. But they didn't talk about diet or sleep or stress in that too, which I found surprising, because you think that they would be certainly modifier risk factors associated with dementia prevention.
Absolutely, especially when you look at some of those risk factors that we just talked about, right?
Yeah.
So I believe it is on the radar of the Lancet Commission team to have a look at those in future reports. But I will say for the dietary one, the World Health Organization has also released their guidelines on preventing cognitive decline, and diet did get addressed in that one. Certain aspects of the diet, of course, so vitamin B supplementation for one. And although the link wasn't strong, it was certainly encouraged that, for people who are concerned about, malnutrition or undernutrition, they should go seek blood tests from their doctor and really have a workup done just to see if they're lacking in any certain vitamins, minerals, how they can fix that, whether through their diet or through supplementation. Yeah, it's really important.
I mean, it's encouraging that at least now that, we're looking at lifestyle factors, and it's not that it's just a normal process of aging and that you're going to develop dementia. There are things that can be done to help prevent the development of dementia, decrease your risk. I mean, in terms of genetics, how important are you aware of the research with regards to how much genetics plays a role in the development of dementia?
Yeah, so I can only comment on what I've read through the Lancet commissions, for example, and then also what I know about some of the other common types of dementia. They do play a role. It varies, between 5 to 15% risk in dementia, but Lewy body type dementia is probably where you see a stronger genetic link as opposed to Alzheimer's disease. And of course, vascular dementia being stroke related, it's more lifestyle than genetic risk there.
Yep. And the vascular dementia, is there also environmental factors and lifestyle factors that increase the risk of somebody developing vascular dementia?
Yeah, I'd say it's actually the same risk factors that we heard about for Alzheimer's disease. So things like physical inactivity are really, really important. We know that exercise helps circulate a lot of blood around the body and to the brain. And it also has a range of benefits across different systems within the body. It helps people sleep better. It helps regulate mood. It can boost well-being overall. And so, yeah, if you aren't physically active or have more of a sedentary lifestyle, it does put you into a higher risk category for a stroke and then ultimately for vascular dementia.
Okay, so it's pretty clear that you keep bringing up exercise and physical activity. So obviously that's a really important component of, for all of us to make sure that we're moving as much as possible. And obviously it's not just dementia, it's the link with the whole range of different medical and mental conditions that we need to encourage for ourselves to do and encourage our clients if they're people are practitioners out there.
Absolutely. And I think social prescribing is now a really key component of that. If you're able to do any of these sorts of activities, like exercise, for example, in a group setting, you're killing two birds with one stone. You're knocking out the social isolation there, and you're also doing something that's really good for your health overall.
Mm-hmm. Okay, so with dementia, or even just kind of memory and cognition, what are there particular memory tests or cognitive tests that people can do or practitioners can do in practice to assess or just get an indication of how people are performing cognitively?
Yeah, I feel like there are different strategies or different ways people can go about this. For the average, person listening in, I would recommend checking out Dementia Australia's Brain Track app. So it sort of builds a profile around your current abilities and, puts you through certain tasks, maps out what your cognitive health looks like. And then as you engage with the app over time, it's able to monitor any changes across your abilities there. So, yeah, it's really handy. I talk about it a lot with the older adults that I engage in community events at. And you're able to then use this as sort of like an evidentiary report for your doctor. So if you are concerned about any changes in your memory or cognition, this is something that you can take into your appointment and sort of say, hey, I have reasons to be concerned here. I'd really like to get this investigated. Yeah.
So with the study that you're doing, how are you evaluating change in cognitive abilities? Is it through a particular test that you're doing? What are you doing?
Mm-hmm. Yeah, so in order to gain entry into the trial, we do use the mini-mental state exam. And depending on where the person scores on that, they'd be marked as eligible or ineligible. And this is a test that is actually routinely used in clinical practice to help with the assessment of cognitive decline. It's not the best test in the world, and it was implemented at a time where people were looking for like an efficient way of going about this. So if people are going in to see their doctor, they might have this test performed on them, whether it's through the doctor or through a clinical nurse themselves, so they can anticipate that.
And it's pretty simple. It's not that hard to, I was going to say, it's not that difficult to administer, is it?
That's right. Yeah. So it's pretty much just asking a few questions, probing about, your memory, how well you know our Prime Minister. And yeah, I think they create a total score based on that. There is another test that is used for people who maybe aren't comfortable speaking the English language. And I mention this because we do have a very multicultural population here in Australia. And so the alternative test or assessment that people might be given in the clinic for this is called the Rudash. And so it's a little less intensive on knowledge about Australian or contextual things. And so it kind of taps into more concepts related to like patterns, animal recognition, things like that.
Okay. And is that something that is freely available? Like if a practitioner wanted to maybe incorporate that as a screening tool to refer people on? I know that the mini mental state exams are available, but is this one available too?
I believe it is.
All right, so there's a couple of options. I know that we've used in our trials, and I agree there's no ideal option. We've used in our trials the Montreal cognitive assessments, which is another similar. They're all pretty similar, and then that's another option. And we've even had telephone-based called the TICS, the telephone interview cognitive scale or something is another option that you can administer over the phone. So there are always options.
Yes, we've used that one in another study as well.
Okay, and any, in terms of, I know, are there any blood tests that people can do, or are we not at that level to do any blood tests to assess Alzheimer's and to assess risk and things like that? Anything there that you can suggest?
Not anything that's been incorporated into practice as yet, but I have heard that there are 2 blood tests that are sort of nearing the end of completion and that validation process so that it does get ready for rollout. One of them has been developed here in Australia from widespread team, and I think it's being kind of led by a Quarry University. So they're hoping it will be kind of released within the next few years. And I was just recently at an international conference for all things Alzheimer's, and I heard about an American research group who is also working on a blood test, and they're getting very, very ready to implement that into practice soon. So I'd say it's on the way, but don't hold your breath, because usually when they make these sorts of announcements, it does take a few years to get through all the regulatory processes and then to actually see it being performed within doctors' offices or clinics, I should say.
It can take a long time. I mean, obviously, if there are blood tests that people can do just to kind of assess general well-being and general health, and obviously assessing for nutritional deficiencies, iron and your B vitamin levels and your folate and things like that, and even levels of inflammation that people can do. And then obviously indirect measures, but they can help just assess, I suppose, general health status and nutritional status for people, and therefore implement interventions accordingly.
Yeah, absolutely. I know one of the markers that seems to be popping up as being helpful for that process is homocysteine. So it is recommended that people check those levels pretty regularly, especially as they get older, just because of the link it has with dementia risk.
Yep. We did, have you measured, in any of your studies, have you measured brain-derived neurotrophic factor, BDNF?
No, we haven't, and it's been on our radar for a while, actually.
We've done that. We've measured it in a few studies to look at serum levels and of BDNF, but I don't know, it seems quite variable. So it's always difficult. So we've had people coming in a fasted state and in the morning to help control for potential variables there, but it can be a little bit tricky. There can be. So I know that often people talk about BDNF and increasing BDNF, and that exercise is really important to increase BDNF, and it's important for neuroplasticity and all that side of things. But in the blood, in my experience, and we've probably done it now 3 or 4 times in different studies, it can be quite variable. So so that's the problem with
I think it's still in that stage of being a peripheral measure of what's happening in the brain, and it's not necessarily a good indicator of what's the BDNF that's circulating in the brain.
Yeah, that's always the problem. So, okay. Now, so I suppose as we age, there's physically we become not as mobile and agile, and muscle deteriorates, and all those things happen. What can we expect from a cognitive perspective? Is it inevitable that over time our memory's going to get worse, our attention's going to get worse? Is that something we just need to, that's just normal and healthy, or it's not healthy, but just a normal process of aging?
Great question. And yes, in a way, there is a to be expected decline in our memory abilities, in our cognitive abilities, much like there is with any other bodily system or function, and like our muscles, for example. So it is just part of the biological aging process. We do lose volume in the brain over time. We do experience, changes in our attention and our ability to hold conversation sometimes. We might lose the ability to remember names and faces, like, what we were doing before. This is all quite normal as people age. I suppose where it starts to become more concerning, though, is when it seems almost out of character for that person. And it starts to impact them on a day-to-day basis. So a lot of the times when I'm running dementia information sessions out in the community, I always get this question, what are some signs, what are some symptoms that I should be looking out for? Mm-hmm. And we just tell people, you really need to track those sorts of signs or concerns that you're having just to see if there is an actual decline that's happening. And listen to family members. If they're picking up on something, especially in conversations, if they're noticing a change, it's likely an indicator that this is very different for you from how you used to be. And so that's something that we would be recording or we would be interested in following up. Mm-hmm. And then there's other signs and symptoms like, it's pretty normal to misplace your wallet or, walking into a room and thinking like, what am I doing here? But what we consider a little bit more concerning is when, for example, if you were to find your wallet again, you're sort of at a loss thinking about like, well, what is this object actually? I don't remember the name for it or I don't remember its function. Okay. So if that's something that's occurring to people, then it's worth having a chat with your doctor about.
Okay, all right. So some of those signs and obviously people being their own control, if there's a uncharacteristic change or a significant deterioration in their own performance, because I suppose some people's memory is brilliant and it's always been brilliant, and other people's memory, even from a young age, wasn't great. And so we've really got to use ourselves as our own assessment of change over time.
That's right.
And I suspect what you're going to say is one of the things that we can do to slow that deterioration is physical activity. Would that be correct?
Yeah, absolutely. It's one of my go-to recommendations or strategies. It's the easiest way that you can start to improve your own well-being, really counteract the detrimental effects of the aging process. So I think the recommendations now are for people to get at least 30 minutes of exercise in every day, which doesn't sound like a lot, but a lot of people in Australia and around the world are not hitting this target. So, we've done a lot of research. We've written a few reviews actually looking at some of the brain function effects of exercises like aerobic exercise, strength-based training, things like yoga and Tai Chi. All of them have really wonderful benefits on the brain. All of them can help alleviate some inflammation, stress, and in some cases, I think more so with the aerobic exercise, it can start to generate or help generate new brain cells. So when you think about Alzheimer's disease risk, for example, where you've got those toxic proteins contributing to cell death, well, you can hopefully counteract that with some of the exercise to keep regenerating some cells.
Yeah. And you mentioned Tai Chi and yoga. Is there evidence around them as beneficial for brain health?
Yeah. So our reviews were able to show that. So the evidence does come from a mixed range of sources. You have some, very high quality randomized controlled trials, but you also have some more qualitative research that's being conducted, especially with those who are in the later stages of dementia. So for people who have maybe mobility issues, or they might have some cognitive issues that impact their ability to do structured strength training programs, Tai Chi and yoga is a fantastic alternative for them to get them moving their body, get them really connecting their mind to their body and improving on aspects of attention, coordination and flexibility.
And obviously, often a lot of those, Tai Chi and yoga is often done in a group setting, so you've obviously potentially had that social interaction, just as long as people don't just go and leave, but that's also another added advantage, I suppose.
Yes, it is.
Now, what about foods? Are there particular foods or dietary recommendations you have for people to help support brain health?
We're seeing that a lot of diets that contain highly fat, processed and sugary meals are quite detrimental to our entire body, including the brain. So there's been a lot of work documenting that westernized diet or way of eating and how it's really detrimental and it contributes to a lot of the dementia risk factors like obesity, diabetes, high cholesterol, high blood pressure. So, the recommendations are always to cut down on those not so good foods and focusing more on real fresh food where possible. Frozen also is fine. I know that some people worry about costs sometimes, so frozen is still a good alternative. But yeah, just really making sure that they're eating real food as much as they can.
Okay, great. All right. So just eating real food, avoiding all the processed and high sugary foods and nothing that, what about is there any specific information, any specific research that you know about around specific foods or food groups that are particularly helpful for brain longevity?
Look, I will say that the specific foods that I know of, I have a colleague who worked on a study recently exploring the benefits of blueberries. So they're known to have anti-inflammatory properties, and they get touted as like a brain protective or brain health food. So there is that option available to people, but I have seen the cost of blueberries in shopping centres lately, and I just cannot believe it, what's happened there. So, yeah, there are a lot of purple foods that people can look at. Blueberries always comes to mind because that's the one you hear the most about in the news. So other purple foods can be really brain boosting. And then there's also the Mediterranean diet or way of eating that has been shown to help reduce things like high blood pressure and just it does have it lowers dementia risk as a result. So that Mediterranean way of eating really focuses more on having seafood as like your main source of protein and less red meat and poultry within the diet. A lot more vegetables and fruit than what we typically engage in here in Australia. And so, yeah, if there's one big takeaway from that sort of lifestyle or that way of eating, it would just be to maybe up the veggie intake and up the seafood intake.
Okay, and just in terms of supplements, herbal ingredients, nutritional supplements, are there any there that you think that there's a good body of evidence to help support brain health?
Yeah, in regards to the supplements, I'd say this comes down to, how much people are getting out of their diet with the nutritional value, the vitamins and the minerals needed to sustain your functioning. So I'd come back to that recommendation before of going and getting a blood test for this first and then seeing where the inadequacies are and how you can address that. In regards to the herbs, though, I suppose the only one that I've really seen strong evidence for in terms of promoting brain health or memory is ginkgo biloba. So the research into that has been extensive. It's been considered to have a really strong effect that's on par with some of the medications that can be prescribed for Alzheimer's disease. So I'm not necessarily recommending people just go out and buy this from their chemist willy-nilly, but if they were going to explore this option with their doctor, then, try to go for something that has been scientifically backed.
Yeah, definitely. The quality can vary significantly across herbal ingredients, so I agree with that 100%. All right. We've just recently completed a study on, I know the research is inconsistent, but we've recently completed a study on curcumin with people with mild cognitive impairment, and we found some positive. We haven't published it yet, but the results were positive from that perspective. But again, there's different curcumin extracts and so forth, but we had some benefits there, and we also did a study with a lutein zeaxanthin supplement too, and again there was some improvements over a 6-month intervention for people with not mild cognitive impairments, people with kind of memory complaints, and we saw some improvements in kind of your visual memory over time. But again, we need to do more research to validate it and look at the different populations and so forth. But there are a couple. We've also done some studies on Bacopa, but we've had some mixed results with regards to the Bacopa.
That's fascinating. So I know that there's a lot of interest in precision type medicine being used. So hopefully, perhaps there's some direction to take with the herbs there. Might work really well for a particular group of people or person and not so much for others.
All right. Well, I could keep going. I feel like there's a whole bunch of other questions I want to ask, but we'll just keep running over time. But I'm really fascinated by the work that you're doing, and I'm really intrigued by the results you're going to get from your current study. And I know 250 people is not big for a pharmaceutical study, but for a natural ingredient study, that's a pretty nice sample size. So I'm intrigued to see the results.
Yeah, thank you. And I'd encourage people to look out for your papers documenting some of these mixed results. I think it's really crucial that we do publish this and let the public know. Yeah,
absolutely. All right. Well, thank you very much. I mean, I love the work that you're doing, and I love some of the stuff that we talked about. So I really thank you for joining us today on this podcast, and I'm sure we'll see more and more of the work that you do, and the more and more of your publications, because I know that you're doing some really great work in the area.
Thank you so much for this opportunity, and likewise, I'm really impressed by all that you've been able to achieve and what your research group is doing on the ground, especially to communicate science back to the people who need it the most.
All right, well, thank you, Diana. So thank you everyone for listening today. Don't forget that you can find all the show notes, transcripts, and other resources from today's episode on the FX Medicine website. I'm Dr. Adrian Lopresti, and thanks for joining us. We'll see you next time.
This podcast is intended as healthcare practitioner education only, and it is not a substitute for medical advice, diagnosis, or treatment.
If you enjoyed this episode, please take a moment to give us a rating and review on Apple Podcasts, Spotify, or wherever you listen to FX Medicine, and share us with your family, friends, and colleagues.